Good day. Today I'm going to tackle about the cardiovascular and the reproductive system. First, cardiovascular. The topics we're going to tackle here is the sequence of blood flow, the agglutinins, agglutinogens, Rh factors, and the hemolytic disease of newborns. Sequence of blood flow. Blood enters the heart through two large veins, the posterior and the anterior vena cava, carrying the oxygenated blood from the body into the right atrium. Then, the blood flows from the right atrium into the right ventricle through the tricuspid valve. When the ventricles are full, the tricuspid valve shuts to prevent the blood from flowing backward into the atrium. Blood leaves the heart through the pulmonary valve into the pulmonary artery and flows to the lungs. The pulmonary veins carries oxygen-rich blood from the lungs into the left atrium. The blood flows from the left atrium into the left ventricle through the mitral valve. When the ventricles are full, the mitral valve shuts to prevent blood from flowing backward into the atrium. Then blood leaves the heart through the aortic valve into the aorta and to the rest of the body. Next is the blood groups. There are four main blood groups, the AB, and O. It is determined by the genes you inherited from your parents. Each group can either be Rhd positive or negative. The ABO blood groups. Each group is identified by its own set of molecules called antigens, which are located in the surface of the blood cells. When a person needs a blood transfusion, the donated blood must match the recipient's blood or complications will occur. The Rh type blood factor. A person's blood type used to be called the rhesus type, now called the Rh type, is determined by a different pair of genes to the ones that determine your ABO blood type. Blood is either Rh negative or positive depending on whether certain molecules are present. Agglutinin and agglutinogen. In blood typing, antigens on the surface of red blood cells are also known as agglutinogens, and the antibodies that react against them are also called agglutinins. Antibodies in the blood are found in the plasma. Agglutinin is a substance that causes particles to coagulate to form a thickened mass. Agglutinins can be antibodies that cause antigens to aggregate by binding to the antigen binding sites of antibodies. Agglutinase is an antibody, lectin, or other substance that causes agglutination. Agglutinogen. Any antigen that stimulates the production of an agglutinin. It is an antigenic substance present in blood cells, bacteria, etc., which stimulates the formation of all agglutinin in blood serum. Agglutinogen is any substance that acts as an antigen to cause agglutinin production. The Rh blood factor and pregnancy. Problems can occur during pregnancy if an Rh negative woman carries an Rh positive baby. If blood cells from the baby travels across the placenta, the woman's immune system will see the Rh positive cells as a threat. Specialized white blood cells will make antibodies designed to kill the Rh positive blood cells. Rh antibodies are harmless until the mother's second or later pregnancies. If she is ever carrying another Rh positive child, her Rh bodies will recognize the Rh proteins on the surface of the baby's blood cells as foreign. Her antibodies will pass into the baby's bloodstream and attack those cells. This can make the baby's red blood cells swell and rupture. This is known as hemolytic or Rh disease of the newborn. It can make baby's blood count get very low. Next, the reproductive system. Here we're going to tackle the different types of contraceptives, focusing on ligation and vasectomy and their success rate, disadvantages and advantages of circumcisions, and the process of menstruation. We have here a long-active reversible contraceptive methods, LARC. First in line is the contraceptive implant. It is more than 99% effective with perfect use. Work for 3 years but can be taken out earlier. Next is the uterine system or IUS. It is more than 99% effective, normally works for 3 to 5 years depending on the type. Next is an uterine device or IUD. More than 99% effective, normally works to 5 to 10 years depending on the type. Next is the contraceptive injection. It is more than 99% effective, and this injection lasts for 8 to 13 weeks depending on the type. Then the next is patch and ring. Contraceptive patch and vaginal ring are more than 99% effective. Next is the contraceptive pill. Combined contraceptive pill is more than 99% effective, and progestin only pill is 99% effective with the right use. Male and female condoms. Male condoms has a 98% effectivity, whilst the female condoms have a 95% effectivity due to that it can break sometimes. Diaphragm caps, it has a 92 to 96 effectivity, depends if it has a spermicide. Next is the natural family planning. Can be up to 99% effective if the natural family planning methods are followed precisely. This includes monitoring of the cervical secretion and your basal body temperature, and is more than effective method effective and is taught by specialists or teachers. Next, the focus of our topic, the ligation and vasectomy. First, we have ligation. Tubal ligation, also known as having your tubes tied or tubal sterilization, is a type of permanent birth control. Tubal ligation prevents an egg from traveling from the ovaries through the fallopian tubes. It doesn't affect your menstrual cycle. Tubal ligation can be done at any time, including after childbirth or in combination with another abdominal surgery such as C-section. Most tubal ligation procedure cannot be reversed. If reversal is attempted, it requires major surgery and isn't always effective. And it has a 99 to 100% effectivity. Why it's done? Tubal ligation is one of the most commonly used surgical sterilization procedures for women. It prevents pregnancy permanently, decreases the risk of ovarian cancer. The risk. Tubal ligation is an operation that involves making incisions in your abdomen. It requires anesthesia. Risks associated with tubal ligation includes damage to the bowel, bladder or major blood vessels, reaction to the anesthesia, adverse reaction, improper wound healing or infection, continued pelvic or abdominal pain, failure of the procedure resulting in future unwanted pregnancy. Things that make you more likely to have complications from tubal ligation includes the history of pelvic or abdominal surgery, obesity, and diabetes. For the results, tubal ligation is safe and effective form of permanent birth control. If you do conceive after ligation, there is a risk of ectopic pregnancy. It requires immediate medical treatment and cannot continue to birth. If you think you're pregnant at any time after tubal ligation, contact your healthcare provider immediately. Keep in mind that although tubal ligation reversal is possible, again, the reversal procedure is complicated and may not work. Next, we have the vasectomy. What is vasectomy? Vasectomy is a small operation to prevent pregnancy. It blocks sperm from your semen when you ejaculate. There are two types. First is the conventional vasectomy. For this type of vasectomy, the doctor cuts your scrotum to reach two tubes. Each tube is called a vas deferens, one for each testicle. The doctor may remove a small piece of each tube and leave a short gap between the two ends and tie it off with a stitch. Next is the no-scalpel vasectomy. The doctor feels for each vas deferens under your scrotum and uses a special clamp to hold it in place. They will make a tiny hole in your skin, stretch it open, and lift this vas deferens out. They'll cut it, seal it with searing, stitching, or both. How effective are vasectomies? These procedures are 100% effective. And in the very rare cases, the tubes can rejoin. If that happens, sperm could leave your body and cause pregnancy. Sperm can still get out for a little while after a vasectomy. Be sure to get the follow-up test that checks on that so you know when you can stop using another method of birth control. Complications in vasectomy. Complications are not common, but if they happen, they can include bruising, inflammation, and infection. Benefits of vasectomy. If you don't want children for a while, or for permanent time, it's a reliable form of birth control you can get. It's also less likely to cause problem than a woman having her tubes tied. If concerned about your sex drive, don't be. The procedure doesn't affect your testosterone level, erection, climaxes, sex drive, or any of your sex life. Next is circumcision. Male circumcision is a surgical removal of the foreskin. Circumcision may be performed for two options only: religious reasons and medical reasons. Religious reasons, circumcision is common practice in Jewish and Islamic faiths. For the medical reasons, although alternative treatments are usually preferred to circumcisions, there are a number of potential advantages associated with circumcising boys shortly after they're born. For example, circumcision reduces the risk of developing a urinary tract infection, reduces the risk of getting some types of sexually transmitted disease, and reduces the risk of penile cancer. Why is it necessary? A medical emergency where the foreskin is pulled back underneath the tip of the penis and becomes trapped and cannot be returned to its original position is called a paraphimosis. It can block blood supply, and if left untreated, the lack of blood supply will mean to the death of the tissue of the penis, and it's called gangrene. In most cases, paraphimosis can be treated using medication to reduce the swelling or minimally invasive surgery to return the foreskin to its original position. Circumcision, on the other hand, is usually only required in rare cases when medication and surgery fail. Occasionally, circumcision may be recommended if someone has repeated episodes of paraphimosis. Next is balanoposthitis. It is an infection of the foreskin, usually by bacteria. Symptoms of balanoposthitis includes pain when urinating, a discharge of the pus from the penis, inflammation of the shaft of the penis. Balanoposthitis can be treated with antibiotics. Most boys do not have further infection. Circumcision is usually recommended only if a boy has repeated infections. Next, as to why circumcision is necessary is because of the sexually transmitted infection. Circumcision is known to reduce the risk of catching 3 sexually transmitted infections. These are the HIV, syphilis, chancroid. Circumcision is known to reduce the risk of a man getting syphilis and chancroid because the foreskin may provide a warm, moist environment which allows the syphilis and chancroid bacteria to grow. The foreskin often sustains tiny cuts during sexual intercourse, which allows bacteria into the bloodstream. It is estimated that uncircumcised men are twice as likely to get syphilis and 10 times likely to get chancroid. However, it should be stressed out that circumcision is nowhere near effective as condoms in preventing STIs. If used correctly, condoms are 98 to 99% effective in preventing STIs. Why is it necessary again? Because of penile cancer. Research has shown the men who are circumcised during childhood are 3 to 4 times less likely to develop cancer of the penis than men who are uncircumcised. This is because many cases of penile cancer develops in the foreskin. The disadvantages of circumcisions are, for what they say, It reduces the sensitivity and the potential complication of circumcision such as bleeding and post-op infections. But that is just rare. And these are the indication for to be circumcised. Balantis serotica obliterans, an uncommon skin condition. Its symptoms is difficulties passing urine, pain when urinating, itchiness and soreness of the penis. Circumcision is usually the most effective treatment and often results in a complete cure. Next, we're going to tackle about the menstruation. Females menstruation. Menstruation is a woman's monthly bleeding or often called period. When you menstruate, your body discards the monthly buildup of the lining of your uterus through the small opening in your cervix and pass out through your body through the vagina. During the monthly menstrual cycle, the uterus lining builds up to prepare for pregnancy. If you do not get pregnant, the estrogen and progesterone hormone levels are falling. Very low levels of estrogen and progesterone tell your body to begin menstruation. The typical cycle of the menstruation is 28 days long, but each woman is different. Regular, they call it if they usually come every 24 to 38 days. The stages of menstrual cycles are menstrual phase, follicular phase, ovulation phase, and luteal phase. For the follicular phase, starts on the first day of your period and ends when you ovulate. Starts when the hypothalamus sends to signal your pituitary gland to follicle-stimulating hormone. Stimulates the ovaries to produce around 5 to 10 follicles. Each contains an immature egg. Only the healthiest egg matures. Lasts for about 16 days and can range from 11 to 27 days depending on your cycle. Next is the ovulation stage phase, where your ovary releases a mature egg, travels down the fallopian tube through the uterus to be fertilized by the sperm. This is the only time to be pregnant. It happens around day 14 if you have a 28-day cycle, right in the middle of your menstrual cycle. Lasts for 24 hours. After a day, the egg will die or dissolve if not fertilized. Next is the luteal phase. After the follicle releases its egg, it changes into the corpus luteal, releases hormones, mainly progesterone and some estrogen. Rise in hormones keep your uterine lining thick and ready for a fertilized egg to implant. If you do get pregnant, your body will produce human chorionic gonadotropin. It is the hormone pregnancy test detects. And if you do not get pregnant, the corpus luteum will shrink away. This will lead to a decreased levels of estrogen and progesterone, which causes the onset of the period. During this phase, if you do not get pregnant, you may experience symptoms of premenstrual syndrome called PMS. Its symptoms are bloating, breast swelling, pain and tenderness, mood changes, headaches, weight gain, changes in sexual desires, food cravings, trouble sleeping. It lasts for 11 to 17 days. That is all. Thank you.